So I'd like to extend a very warm welcome to everyone for this evening's event. My name is Charles Burdett, and I've recently started work as the director of the Institute of Modern Languages Research. The role of the Institute is to act as a focal point within the disciplinary field of modern languages and culture. It is to promote connectivity between its branches of study and areas of interest, and to ensure that advances in modern languages research contribute to a much larger field of interdisciplinary inquiry, and to contribute also to pedagogical practice, both within the sector and beyond. Above all, the role of the IMLR is to act as a forum in which to discuss the contribution of modern languages research to current societal questions and to areas of urgent topical concern. Crucially, therefore, its role is to ensure that research findings are shared and debated with as wide and as diverse a public as possible. In a context in which we are confronted almost on a daily basis by issues of imposing societal concern, the importance of approaching culture through language, of understanding how the local and the global are always inevitably deeply interwoven, of reflecting on the positionalities from which we speak, and of promoting focused and wide-ranging discussion cannot easily be understated. So it is in that spirit that the events in the Open for Discussion series have been organized. But to speak more specifically about the purpose of this evening's event, I shall pass the word to my colleague, Godela Weiss-Sussex.
Sorry, unmuted. So thank you very much, Charles, and a warm welcome from me as well. In recent discussions on the handling of COVID-19, the international dimension has been raised to an increasing extent. Difficulties with isolationist approaches have become apparent. Warnings against vaccine nationalism have been sounded, not least by the World Health Organization. Calls for greater efforts towards transnational collaboration have been growing louder. In a scientific context regarding vaccine production and distribution, it is immediately obvious how essential a joined-up international approach is. According to a report by the Institute for Global Change, launched in February, entitled "The New Necessary," international collaboration could have reduced by several months the time needed to prepare vaccines. Equally clear is the need to distribute vaccines across the world in order to stop the development and spread of variants. But the transnational aspect is important well beyond the purely scientific context, and this is where the humanities come in, as they are concerned with the socialization and dissemination of narratives of ideas, including scientific ideas, with making sense of experience and with contextualizing. An awareness of other countries' social and cultural practice, learning from their experiences and collaborating with them, will be necessary for future directed efforts to build a better reality as we come out of the pandemic. In this current series of the School Advanced Studies Open for Discussion events, the transnational dimension of a humanities-centered engagement with post-COVID society renewal has repeatedly come into focus. So to an extent, we're building on this by directing our attention explicitly to it now, thus widening the scope of the inquiry and doing so in the disciplinary context of the field of modern languages. Modern languages, as Charles has just outlined, is the framework. And the focus of the inquiry today is to reflect on the handling of the pandemic in various parts of the world, to identify lessons that can be drawn for the UK, and to consider necessary steps for building a more successful post-COVID international community. In particular, we will be asking, what are the contributions to be made by the humanities and specifically by modern languages? Let me also announce a second event here, a sister event to this one. On Tuesday next week, Joe Ford and Naomi Wells will be discussing the handling of COVID with respect to multilingual communities within the UK. But today, we have invited speakers with expertise in various regions of the world: Europe, Latin America, Africa, Asia, the Pacific, and occupying various positions and perspectives within our field. So I'll hand back to Charles now for short introductions of our guests before we hear from them themselves.
Thank you, Godela. I'm going to say just a few words about our speakers in the order in which they appear in the short video that we're going to show in just a few moments. Astrid Earle is Professor of Anglophone Literatures and Cultures at Goethe University, Frankfurt. She has worked on German, British, South Asian, American, and South African literatures and media cultures. Leon Rocha is Senior Lecturer in Chinese History and Society at the University of Lincoln. He is a specialist on the history of science and medicine, especially the global circulation of knowledge and expertise. His most recent project is Mapping and Diagnosing Mental Health in/and the UK university sector. Ignacio Peiro, who unfortunately can't be with us this evening, is a cultural and political journalist for leading Spanish language newspapers, an editor, a writer on both literary and artistic subjects, and a translator. From 2017, he has been the director of the Cervantes Institute in London. Charles Forsdyke is Professor of French at Liverpool University and a specialist on travel writing, colonial history, post-colonial, and world literature. He was, until March of this year, the theme lead for the major AHRC research initiative, Translating Cultures. Alejandro Arenas Pinto is a physician with training in infectious diseases and tropical medicine. He is a senior clinical scientist at the Medical Research Council Clinical Trials Unit at University College London, working on the treatment of infectious diseases. Nelson Mlambo is senior lecturer at the Department of Languages and Literature Studies at the University of Namibia. He is a specialist on intercultural communication, rhetoric, and literary studies. He was a key investigator in the AHRC project, Transnationalizing Modern Languages, Global Challenges. And I'll just say a few words before we look at the video that both Godela and I have mentioned about the organization of today's event. We're going to look at the video with short extracts from the longer videos that our speakers have prepared and which are available on the events page of today's event. I'm then going to ask Stephen Wilson to respond to the speakers' interventions. Stephen is Senior Lecturer in French Studies at Queen's University Belfast. His research concerns the ways in which modern French literature from the 19th century to the present contributes to cultural understandings and linguistic articulations of illness, disease, pain, and medical practice. He's currently principal investigator on a British Academy funded project, The Languages of COVID-19, Implications for Global Healthcare. After Stephen's response to the video, we're going to ask speakers for comment, and we're going to discuss issues led by Stephen and Godela among the panel members. And then we're going to conclude this evening with discussion of questions raised by the audience. So please do post a question in the Q&A, not the chat, the Q&A function, and I will pick those questions up and pose them to the panel. So, without more ado, if we could show the video.
In 2009, researchers from University College London found out that it takes an average time of 66 days to form a new habit. In 2009, we were probably thinking about giving up smoking and taking up some kind of sport. Now, we have had 6 times 66 days of getting into the habit of wearing face masks or holding people at 1.5 meters distance. Obviously, I don't say that any of this is good. Although some of the changes and new habits are more time for being with the family because of home office, less air pollution because less travel, for example. What I want to say is that there's a chance in it, the chance of using our experience with change and changing habits during the corona epidemic. There is the chance of treating this experience as a cultural resource, of making the transfer to other areas in order to tackle the challenges ahead of us. Climate change cannot be halted. All Germans always want to drive big cars. Injustice will be injustice. Shareholder value trumps global health. Global economy will always exploit people and the planet. I am not so sure any longer. Corona could have taught us that the world is not as stable, as immutable as we thought. It can change fast. Corona could have taught us that we can kick almost any habit. So let's start to imagine which habits we want to kick now that we're at it.
I would argue that Hong Kong's success in dealing with COVID-19 could be, in part, attributed to the fact that Hong Kongers are radically skeptical, if not openly hostile, towards state government. This meant that Hong Kongers, in the beginning stages of the COVID-19 pandemic, moved swiftly to safeguard themselves and their families, and they were often well ahead of government policies, and this spurred the alternately differing or obstructive Hong Kong government into serious action. Deep levels of grassroots organization and the spirit of mutual aid, a constant feature of the protests in 2014 and 2019-2020, were rapidly redeployed by young activists towards combating COVID-19 in local communities. And of course, it would be simplistic to suggest that the lesson is to screw the government and save ourselves. However, the case of Hong Kong does provide perhaps a rather old lesson, one that needs to be learned and relearned. That even under extremely challenging political circumstances, so in the past weeks, the Hong Kong government has been systematically arresting activists using the national security law, citizens are perhaps not completely powerless and without influence. So the lesson perhaps is be informed, join a union, get organized locally. The government is probably not your friend, and expect no saviors and no shortcuts. Thank you very much for listening.
After our financial crisis that hit us very hard about a decade ago, and still in the midst of this pandemic, one wonders if we have not learned anything from this. When are we going to learn something? I do think there are already some lessons that we have come to learn. First of all, we will hardly ever think again of the state, the public sector, as an avid leviathan. We need doctors and nurses. Scientific research is a priority and not a luxury for some ultra-developed countries. Second, we have realized that this leviathan, however, really exists. We have been stuck at home and there were heavy fines if you broke the law. Governments have kept their citizens at home for the first time in our lives. Of course, it was with good reason, it has been with very good reason, but we have to watch it won't become an habit. And third, and last, it is not only necessary to have good ideas, but also practical policies. It seemed, for instance, perfectly fine for the EU to coordinate the purchase of the vaccines, but the Commission did not have the expertise to do it properly. And I think this is yet another lesson to be learned. We do not only need these beautiful ideals of solidarity, but we also need the practical policies that can bring them to reality.
The current situation in France would perhaps not have been anticipated 12 months ago. When the pandemic began, we saw the benefits in France of a strong hospital system. France was instrumental in controlling movement in the country, imposing curfews, and did that much more swiftly than was in the case in the UK. What we're seeing now, though, of course, is a much slower rollout of vaccination, and also an associated lack of public confidence in the vaccination program. There are two other elements I think we need to consider. One is the overtly politicized nature of the public health response. President Macron, is preparing for the challenge of the far right in the April 2022 presidential elections. And if you look at his decision about a third lockdown, his comments on the AstraZeneca vaccine, I think what's evident is his desire to show that he's capable of shaping events. So minimizing the slow vaccine rollout in Europe, dealing with new COVID variants, as opposed to simply accepting events. There's a problem for Macron, that is that his big claim on which he was relying for re-election, that is structural change that he's brought about, has allowed him to tackle unemployment. Well, that now, as a result of COVID-19, is in tatters. So through the response to the pandemic, he seems to be seeking new narratives. There's another part of the French context that I'd like to mention, and that's linked to questions of Republican universalism. Colorblind policies in France, particularly relating to the refusal to gather ethnic statistics, mean that it is very difficult to gauge the differential impact of COVID-19 on ethnic minorities in the country. That makes, of course, targeted public health interventions more difficult.
At a society level, I think there are some important issues that have been made quite obvious and clear to everybody. And the first one of this is, of course, inequalities. So access to care, access to effective care is different depending on where you are, depending on who you are, and differences in access to care are there, differentiating not only countries, regions, cities, but also groups within the same society. And that is an important element to keep in mind. And to do so, we may take advantage of some of the changes we have already implemented in the way we look after patients and communities through national health systems. So one of them is, of course, the use of telemedicine and other remote access systems to seek and provide care. These are very important tools that may be very useful and may have a very positive impact, not only in high-income countries, but also in low middle-income countries. So in those regions where the number of healthcare providers may be limited, taking advantage of remote access to care may be an important opportunity to improve health for most of the population. However, we were saying at the beginning that inequalities is potentially one of the most important challenges that we need to deal with. And by relying too much on living too close with technology in terms of the provision of care, then we may be introducing yet another barrier, limiting access to care to some individuals, groups, and populations that because of socioeconomic, cultural, or other structural barriers may have more limitations. So we can be finding it much harder to deal with technology and access care through that way. And finally, the other element, which I think is quite important and has been made quite obvious impact in the course of the pandemic, is the need and importance of a robust, coherent, and effective healthcare system at a national level. Those countries which are not having or having had a healthcare system able to provide care in a systematic way are also those who are paying a high price in terms of number of cases, number of deaths, and more negative impact in the society. So the importance of protecting, investing, and developing healthcare systems is quite clear, as well as the need for making sure that investment in scientific research is protected and increased to tackle the health risks that are emerging through this pandemic, but also which may be coming in the future.
Ladies and gentlemen, I think I can safely say that, as has already been demonstrated through previous humanitarian crises such as the Ebola virus and the Zika virus outbreaks, when information is provided in languages that people can understand, many lives can definitely be saved. Therefore, in my view, local languages are important during the COVID-19 pandemic because they are an integral part of the communication strategy, and they also help to uphold the human rights and fundamental freedoms of their users, and that is what is critical. So my point here is that the use and application of local terms and concepts brings to the fore those intercultural mediation practices which are focused on the cultural, social, and environmental needs of indigenous people. So as such, it is not just an adaptation process, but a critical analysis that considers the context and resources that are available for such specific communities in order for them to follow prevention measures. And the success of prevention communication definitely depends on the consultation process itself with indigenous communities. And these consultations and consensus-based approaches and actions allow the appropriation of the contents themselves through, number one, self-identification, number two, social empowerment, and number three, community involvement in decision-making. And that becomes critical. And this is exactly what we have seen through the integration of Western concepts as well as the traditional concepts, and language being the key cement, the key enabler, the glue that binds all this together.
Okay, Stephen, I hand over to Stephen Wilson now for a response to these clips.
Thank you very much, Godela and Charles, for convening this important event this evening. And it's my privilege and pleasure to respond to the videos. I watched the full version of all the videos which are available on the IMNR website. And I just want to pick up on some of the points made by the speakers who, from their various backgrounds in literary and cultural studies, communication, journalism, the history of science and medicine, and infectious disease, collectively demonstrate the importance of multidisciplinary perspectives and our reflections on what we can learn from other countries and cultures in relation to COVID-19. As I watched the videos, I kept coming back to this word pandemic, because as I thought about the reflections offered by our contributors, it seemed to me that there was a tension to be grappled with between, on the one hand, a global response to a pandemic coordinated by the World Health Organization in Geneva, and on the other hand, a need to take into account national, regional, and local specificities in how any disease operates. And I think this is important because if any of you have read Eugene Richardson's book, Epidemic Illusions, on the coloniality of public health, published just last year, you'll know that he demonstrates that the practices of the major global health authorities are often underpinned by the values, norms, and perspectives drawn from the global north. At the etymology of this term, pandemic, then, we have a tension, it seems to me. Pan, on the one hand, meaning everywhere, a disease that, as we often hear, especially from politicians, a disease that knows no borders. And on the other hand, demos, a reminder that disease principally affects not political systems, not even national healthcare structures, but people or peoples in all of their cultural, ethnic, and political diversity. So transnational, multidisciplinary approaches to this pandemic, and indeed to any global disease, are essential if we are to grapple with its complex ramifications. And that's why I think this evening's conversation is so important. But I also think it's significant that we are meeting here at the IMLR, albeit virtually, because what came across powerfully in the recorded contributions was that culturally aware and linguistic sensitive perspectives are badly needed on the lessons to be drawn from the global pandemic. Our panelists spanned a variety of geographical and cultural settings, from the Caribbean to Europe to Africa to the Far East. And there were some important conclusions to which they drew our attention, particularly in relation to Alejandro's key point on the unequal vulnerabilities that have been illuminated by this pandemic. Nelson, for example, pointed us to the exclusion that occurs when public health messages are not communicated in local indigenous languages that citizens, particularly in some African countries, can understand. And I particularly appreciated Nelson's point on the need to court marginalized voices in responding to a pandemic. Leon focused on the situation in Hong Kong, and I was particularly struck by the role of local community grassroots movements who, because of their mistrust in government, have taken to sharing information with each other on secure platforms. Charles prompted us to consider some of the lessons to be drawn from the Francosphere, including the fact that metropolitan France's Republican universalism results in these colorblind policies and a refusal to share ethnic statistics, making a targeted public health response to some of the most marginalized, vulnerable communities most affected by the pandemic particularly complex. I find Charles's reference to Haiti especially intriguing. Haiti, of course, has managed COVID-19 relatively well, but the country's 2010 cholera outbreak, whose origins were initially covered up, but widely believed to be the result of contamination by infected United Nations peacekeepers, all of this has left a scar of distrust on the conscience of the local community there when it comes to local medical intervention. And this has important ramifications for interventions such as vaccine deployments. Nonetheless, there are, at least to date, relatively low numbers of COVID infections and deaths in Haiti. And this got me wondering a little bit about the role of cultural figures in using their authority to promote important public health messages instead of global or national authorities doing the same. We've seen, for instance, over the last year, examples of rappers in Haiti, but also youth choirs in South Africa, musicians in Nigeria, among many others, countering false information about COVID-19 and using music to spread vital public health messages. And I just want to draw everyone's attention to a really good event that the IMLR had a few months ago on coronavirus and pop culture in French, Spanish, and Portuguese speaking cultures. That's available online. And all of this brings me to the final point that I wanted to make before we open up to have a wider discussion. What I noticed from the contributions, and indeed what I've noticed from my own work and on my British Academy project on the languages of COVID-19, is that much of the work that we are doing in the humanities at the moment in relation to the pandemic has centered on the social and political dimensions of disease, or the translation of the epidemiology of disease into effective public health messages. But what we haven't seen so much of a focus of, at least to date, is on the patient's experience of disease, or the medical carer's experience of the pandemic, as captured in cultural media, such as novels or blogs or films or oral testimonies, all of which are beginning to emerge and no doubt will contain much more and new information on the pandemic, and particularly its impact on individuals. So I want now to draw my response to a close and to open up this wider conversation by suggesting that in the next stage of our response to the pandemic, one of the elements we need to turn our attention to is patient voices, especially the voices of marginalized groups who've been disproportionately affected by COVID-19, and to the languages that give voice to the experience of undergoing COVID-19. And this is important because this pandemic is far from being over. There are, as Alejandro said, new health risks on the horizon. We need to start thinking about the implications of new variants, but also possibly new pandemics, as well as the chronic, long COVID, mental health repercussions of everything that we're living through at the moment. As Astrid put it so beautifully and so powerfully, we live in this mundus inversus, this world turned upside down. And I don't think we're going to see that reversing anytime soon, if ever. Dr. Mike Ryan of the WHO put it like this: COVID-19 is a wake-up call on the need for us to do science, logistics, training, government, but also communication much better. And so I simply want to conclude by agreeing with Astrid that there is much work for us to do in trying to understand the enormity of what we're living through and the challenge of what is yet to come. Transnational multilingual approaches are crucial to that endeavour. And perhaps this is a moment for us to reassert in the academy, in our institutions, in cultural institutions, but also beyond them, in schools, in outreach events, in public engagement, that we will better understand, prepare for, communicate, and respond to pandemics if we pay attention to how they are conceptualized and articulated in languages and countries other than our own.
Thank you very much. That was a wonderful way of pulling things together, and I think a great starting point for discussion. But I think before we launch into the discussion, it would be good to give all speakers the chance to respond briefly. And I think let's just take this in the order that that the video showed them. So Astrid, are you happy to kick off?
Okay, which means that I will start. So thanks first of all to everyone, because I really enjoyed watching the videos, which were so full of very important details from different places of the world. And thanks, Stephen, also for your really insightful response, which puts the accent somehow on the next cultural and language-wise step. And that is, when will we see the point when the first Corona novel emerges? When can we hear the voices of those who were affected? In Germany, I have the feeling we don't really hear them yet. We see the statistics, we wonder what's behind that, but these voices will only emerge in the time to come. And from my perspective, and I work in collective memory studies, that means the process of collective memory will get more intensified, and will thus prepare global societies for the next whatever pandemic, next global event. And for me, that's really a cycle, a process. And I would like to say two more things in that direction. When I listened to your interventions, your videos, three things struck me as leitmotifs that cropped up in almost every video. And the first has to do with this collective memory. It seems that the way in which societies cope or don't cope at all with COVID-19 has a lot to do with cultural experience and collective memory. Why does it work so well in Hong Kong? They know it. They've had Asian flu, they had SARS, they have the mental paradigms there, they have the habits there. Why didn't it work in Germany? 1 year ago, nobody could imagine wearing face masks. What a ridiculous thing. We were not in the habit, we had not learned it. And the fact that 100 years ago, during the Spanish flu, we did it, that had been entirely forgotten. And in Vietnam, that was Charles's fourth example, and in Hong Kong and in other Asian nations that experienced that collective memory was reactualizable. They could basically hop on and act. Two more things that struck me, and you've already mentioned them, Stephen. Many of you highlighted communication. That's important. You need to find ways to communicate, perhaps in cultural sensitive ways, in order to create that compliance that we need. And the third point is, for me, what I would call communal action. You called it shared citizen responsibility, the spirit of mutual aid. COVID-19 has really shown us that we cannot have this, as one German said it last year, comprehensive insurance mentality. We cannot have that full security, that full safety that comes from above, but we need to act, and probably sometimes act quicker and act in a more intelligent ways that politicians suggest acting. That's it. Thanks.
That's brilliant. Thank you very much. I'm sure we'll come back to many of these points. Leon, please.
Hello, I think I have unmuted successfully.
Yep.
Perfect. So thank you very much to everybody, and particularly Stephen, for his response to the video. I suppose, I mean, since making the video, I have sort of thought about this, the case of Hong Kong a little bit more. And I suppose what we would really need to do next in terms of thinking about, you know, how to push this kind of research and thinking and sort of dealing with the everyday experience of COVID-19 a little bit more. I think I do think that we urgently need to look at the rapid collection of oral histories and interviews before people's memories start to shift or turn their attention to other things. I think it's particularly interesting to look at the sort of tactics of everyday life in different places, whether it's Hong Kong or in Germany or in this country. And I think another thing that I've been thinking about is, again, I was struck by Nelson's contribution on the need to think about language and translation and science communication and public understanding. But I also think that there's a more fundamental kind of epistemological question to think about, which is that I think for much of this pandemic, governments have often operated on a kind of knowledge deficit model. So the idea that, you know, if only we are able to supply more accurate information to citizens about the pandemic, then citizens would follow public health interventions and so on. And I just don't think that's necessarily true. And I think it is also parallel to multiple governments' inability to deal with, you know, phenomenon fake news on social media and so forth, operating on a sort of knowledge deficit model of public understanding. That's the second thing that I've been thinking about. And then I guess particularly, and I know this is an issue that we'll be coming back to next week when we think about multilingual communities in this country. Obviously, you know, in thinking about Hong Kong, we mustn't forget that there are large Sinophone, diasporic, if you like, communities in this country, in the United States, in Australia, and so forth. And they have often very deep familial connections, cultural connections with the People's Republic of China or Hong Kong or Taiwan. And they often have sort of very divergent experiences of dealing with and surviving COVID-19 compared to, you know, the rest of the UK population or the white population in Australia, for instance. And so thinking about diasporic communities will be another thing that we need to be thinking about. And then actually there's a fourth thing, and I'll just very quickly say this, which is the way that like power and governmentality sort of work in different places. So the reason that, you know, Hong Kong is such a sort of, it's such a fascinating case, fascinating for good and bad reasons, I suppose, is because if you want the most deregulated, hyper-capitalist, neoliberal place that there is, financialized place there is on this planet, it is Hong Kong. And as we know from the sort of post-Foucauldian scholarship of people like Thomas Lamke and Nicholas Rose and Wendy Brown, for instance, one of the key tactics of neoliberalism is responsibilization. So the idea of making citizens responsible for matters to do with health and retirement and education and so forth, while the state can continue to sort of recede in the background, becoming smaller and smaller government. But here in Hong Kong, we find that sort of neoliberalism has almost eaten itself, in the sense that, like, the population has become so self-responsibilized that they are going against the government, exceeding the government interventions. So that places a very interesting difference, I suppose, or divergence from the kind of, in thinking about government and power and governmentality, for instance, in the UK. I think that's a little bit rambly, but that's the points that I have. Thank you.
That is indeed, I think, one of the main points that I was also struck by the, you know, in your report on Hong Kong. You know, this, so often we've heard in the last weeks and months that what is important is that people trust their governments, because only then, you know, can communication be successful. And then you show us that, you know, exactly the opposite works in Hong Kong. So yes, thank you. Okay, Charles.
Thanks, Godela. Many thanks to the IMLR for putting on this event. It's a real pleasure to be able to be in conversation with fellow panelists, and particular thanks, as Leon said, to Stephen for a characteristically incisive engagement with quite a broad range of ideas and situations that we've talked about. And I just wanted to pay tribute to the work of Stephen and his collaborators over the past 12 months, who really in the white heat of the current situation and sort of grappled with hyper-contemporary questions, and have really shown us how work at the intersection of modern languages and the medical humanities can make a difference. Just 3 points really. The first picks up on something that's implicit in a number of the interventions, and that is explicit, as Stephen said, in our mode of meeting tonight. And that's the importance of thinking about the tensions between mobility and the digital. I think what's really important when we talk about transnationalism is that term, the body of thought relating to it, emerged from a concrete reflection often on physical mobility of people and goods. And clearly one of the paradoxes of our current situation, and in thinking about the current situation transnationally, is that we've shifted from a situation of hypermobility, which in many ways created the health crisis we find ourselves in, to one of imposed, in many cases, immobility. And within that, I suppose what interests me is that intersection between digital concerns and transnational concerns, and the need for us to think those through in a more sustained way. Alejandro spoke about telemedicine, and that's clearly part of the response here. But I think for those of us in the humanities and social sciences, there are a series of questions about major existential and experiential shifts that we've seen over the past 12 months, which go back very much to Astrid's comments. Migration corridors have stopped. The mobility of fast castes has temporarily come to an end. And I think that tension between mobility and immobility, and the way that manifests itself in the foregrounding of the digital, really is something we need to think about. Stephen, again, really helpfully, and I think it's associated with that point, began with that reflection on the micro and the macro, and those issues around levels of granularity, and he really foregrounded what I think a number of us spoke about, and that's the interconnectedness of an increasingly globalized world, which is on the one hand a source of contagion in the first place, and we can historicize that, of course, but is also a key to the solution. What really interested me in listening to my fellow panelists' interventions was that sense that in each case, despite the shared challenge, we're talking about a specific historical, socioeconomic, and political niche. And clearly, the sorts of comparative transnational approaches that we're broaching allow us to think about that. And I'm grateful to Stephen for bringing up something I touched on, which is the case in Haiti, which has some unusual resonances with Leon's case. And I think you suggested this, Stephen, in that part of the response in Haiti is to do with an on-the-ground solidarity, which is rooted in a distrust of government and, crucially, governance as well. And I think, yes, we can historicize. We can think about the cholera outbreak, but which is linked itself to UN troops and to transnational movement. And the key thing for me with Haiti is it allows us to pick up on what a number of the interventions mentioned, and that's the way in which we've seen an exacerbation of global inequalities over the past 12 months. And one of the reasons I mentioned Haiti is because we're thinking about lessons of the UK. Well, we're looking at a situation where the government has, in many people's eyes, illegally reduced the commitment to overseas development assistance from 0.7% to 0.5% at a time when places like Haiti, which are extremely vulnerable for some of the reasons I talk about in the video, need an acceleration, particularly of the vaccination program, on a day in which, and you've maybe seen this in the media today, COVAX is simply not delivering on the level that was anticipated. It's probably about 20% of the anticipated doses will be available by May, because of a range of problems that we can talk about. So that's why that particular case interests me. And before we move on, just to echo what both Astrid and Leon have said, absolutely fascinating, Stephen, that idea of focusing on the representation of the patient's experience, the experience of health workers. In the early stages of the pandemic last year, in terms of comparative historiography, I was really interested in comparisons with the Spanish flu pandemic in 1919, and some work there on trying to identify precisely what Stephen spoke about. How are those experiences captured? And when, and this is something Astrid mentioned, when did the Spanish flu novel appear? And I think there's speculation now in when is the first great COVID-19 novel going to appear. Personally, I'm not interested in that for the reasons Stephen mentioned. That's something for further down the line. What we need really is a cross-cultural observatory to pick up precisely on those spontaneous responses that we're seeing, particularly in social media. And I think what's interesting is we don't really need mass observation because that's possible across a range of platforms. And also, and I shall promise I'll stop here, there are some, sort of in the avant-garde here, there are some cultural forms which often we ignore. And what's really excited me over the past 12 months is the way in which graphic artists in comics and graphic novels are really engaging with and capturing those experiences that Stephen said that we ignore at our peril. So thank you very much again.
Thank you very much, Charles. May I just come in here and just mention an event that we're putting on the 30th of April. It's entitled COVID and the Woman Writer. And what we're going to do there is look at new texts that have emerged, but also at the experience of writing, the experience of writers. You know, how has this pandemic changed their ways of writing? So yeah, you're all very welcome, 30th of April. Anyway, Alejandro.
Yeah, thank you very much. I have to start by saying that personally this has been a complete uh, kind of change in my lifestyle for the last year or so, and an opportunity to think and learn from experts in disciplines that I am not exposed to on a day-to-day basis. So I'm just switching from patients' needs, designing and conducting clinical trials, and thinking about vaccine coverage and designs to talk about something completely different, but essential to everything we try to do in a hospital setting or an academic scientific setting, which is at the end of the day, uh, uh, what we are trying to protect is and to restore is the health of the people. And I was thinking on precisely that because I just trying to understand what health means, and I think the health may have different meanings for different people, different groups, and different cultural backgrounds, and in that context, it is unfortunately for us, there is not such a thing as a one size fits all. It would be very easy for me to say that I have a magic tablet that will fix and restore health for everybody at the cultural, at the societal level, and that's not the case. And it cannot be the case because we need to understand that there is an element here of personal commitment and a personal decisions made on uh, everyday questions on how I am responsible, how much I am responsible for my own health and the health of people around me. And this is an element that in the pandemic scenario is has been put into question for many people. And I think uh, there is a new sense in many people on responsibility, on self protection, and our own relative and our own groups, and perhaps the examples in Haiti or Hong Kong are extremes, but I can see it in a day-to-day interactions with patients where different communities have been taking their own decisions on how to protect the health of the most vulnerable in their own groups. And this is an element which is extremely important. And there's the concept of vaccination and protection is just may have access to a chemical component that can protect you and others, but at the same time is my own behavior, my own relationship with society, which actually can produce changes that can make life safer for everybody. And this is something that I think we are discussing now. And it's very interesting to see that even in hardcore basic science circles, people are understanding that, well, if you want to generate knowledge that can benefit the most, you need to make sure that it is coming both ways. So it's not what we do. What is making change is what people take from what is available, what actually can make changes in society. And that is something that, at least in my side of the world, is not normally a part of the discussion. The other element that I think is important is that and it's linked to that concept of responsibility is that it is both ways as well. So this where we're talking about is an infection that is essentially transmitted from human to human. So it is a human to human transmission, but at the same time, it's a human to human protection in a way. So it is covering your face, keeping social distancing, and reducing the risk of exposure is not only a way of protecting me, but it's also protecting other people. And that's an element that it is somehow being digested by some groups and somehow may have implications in the future. And then the final concept, and I think is quite important for us and have a lot of political implications, is that the fact that has been said many times over the last few weeks, and I think we need to say it again and again, is that no one will be safe until we all are. And this is an element in terms of the limitations on approaches. And I understand that politicians and administrators, they have the responsibility to act in function of covering and protecting their own communities, their countries, their citizens, if you wish. But at the end of the day, there is no way of protecting Great Britain or France or Germany or Haiti or any other country or region in the world until everybody is protected. And if that means vaccination, that means that vaccines must be available to everybody. The trick is that we are not going to solve this with a global round of vaccination. We may need to do this in a different shape and form in the near future again. And by doing so, we need to rethink on the approaches to health systems in a global scenario. And that is a big challenge because, again, health is something different for different people. Thank you.
Thank you very much, Alejandro. And I think your point about the need to think from both ways, the top down and bottom up, I think will resonate quite a lot also with what Nelson was talking about, the need for language use. So Nelson, may I invite you to comment?
Okay, thank you very much, ladies and gentlemen. Maybe first and foremost, can you allow me to join without a video because my internet bandwidth is quite low and I've missed maybe 40%. So hopefully you are going to hear me even though I don't have a video. I really enjoyed Stephen's interventions, and this sort of webinar has brought about quite a number of issues which I had really never thought about. And from Stephen's interventions, one of the things that has come to my mind is the mantra which is within the Namibian socio-cultural sphere, which is that no one should be left behind. Significant for us to think about because we are looking at issues that confront humanity, and these are issues of a global nature. And by so saying, it becomes quite critical that collaboration becomes the center of what we can do and what we should do. And this is exactly what most of the panelists have also spoken about. And with regards to that, I think the other dimension which we need to think about are the cultural configurations with which we should confront such issues so that we can bring about comprehensible inclusivity, because without inclusivity and without collaboration, then we may not be able to attain that which we want, because by the nature of COVID-19, for example, it affects each and every part of the globe. And looking even at resource-constrained contexts becomes very important, because those are the contexts which we need to outreach to. And by so saying, I can give an example of the inequity in the context of Namibia, and Alejandro has been talking about the issue of vaccines and who exactly has access to vaccines. And before we even talk about access to vaccines, how about the level of acceptability of these vaccines? Who exactly thinks that this is the way to go, and how do we communicate such that therefore the issue of communication also becomes quite critical? And that for me is something we need to think about. And when we think about that, of our interventions, how do we mix the global and the local, because the global and the local working together can bring about significant results. And with that, ladies and gentlemen, I thank you.
Well, thank you very much. Thank you to all of you. I think we are right in the middle of the discussion already, and some very, very important points have come out. And I'd like to just carry on with the thinking on one of these strands, which is about the idea of communality, the idea of, on an individual level, the need for responsibility on an individual level, which connects with the need for an awareness of communality on a local, regional, maybe national level, which then connects with the idea of connectivity on a global level. Okay, that needs to be communicated, that needs to be ingrained, that needs to be made a new habit of thinking. It's a new way of thinking. How best, I mean, I know it's a kind of question that if we solved that, we'd be great, in a better place. But how best, in your view, how best to ingrain this more international, more communal way of thinking in people? How do we make people understand that, as Alejandro put it, no one will be safe until we all are? How do we go about this? And I Astrid was talking about one way, which is to make sure that the communal memories get strengthened. But how did the communal memory or the collective memory of the Spanish flu go so wrong? I mean, why did we forget about it? Anyway, please respond, anyone, to this.
Probably just the first step, that would of course be mediation. And that was the thing with the Spanish flu. It happened at the same time as the First World War, and that was the thing that was commemorated for obvious reasons. And there are not many outstanding mediations of the Spanish flu that would have moved across the generations. And how to make people aware that we have to think differently about communality, as you say, and our connectivity on a global level. The simple answer, the first answer for me is tell them, show them. I was intrigued to hear so much about the Hong Kong model, and it helps me to see best practice models from elsewhere. That would be a first step.
Thank you. Stephen?
Yeah, I thought, Godela, while you were talking there about the historical approaches, there's so much to learn from those, but actually contemporaneously, I think we've a lot to learn from the last year about this tension between individuality and collectivity. And I think so much of that manifests itself through what we might call an ethos of care. This idea of care is really important. I was so struck when Alejandro was responding there to the when he was talking about his perspective as someone who works in health with patients in a hospital setting, but he's not working simply in the domain of health, he's working in health care. And there's something much more expansive about that term, I think, than simply health itself. And I think we have to get to a place where we have a much more holistic understanding about what care means. I don't think it just means having a vaccine. I don't think it just means ensuring we don't get COVID. I think it means how do we ensure that we don't put other people at risk. So for me, this ethos of care that we've seen over the last year in this country, we've seen people standing on their doorsteps at 8 p.m. clapping for carers. We've seen hashtags about valuing our carers. I think this ethos of care is a really important way of bridging this gap between individual responsibility and a more collective awareness of our duty to each other, of our care for each other in this global pandemic.
Thank you. Yes, I think so. Taking it between what Astrid was saying and Stephen was saying, it's a kind of an intellectual approach, but it's also an emotional approach. The two need to come together. And when we're thinking about what you mentioned here, the learning from one another and to learn from other cases, then again, we're back at the language issue. When you think of the communication that is being put out by, for instance, the World Health Organization, they use, I think it's the 6 UN languages they use. But there are thousands of languages in the world, and often it is the minority diaspora communities that are not reached by this kind of information. And of course, then they are, you know, vulnerable to misinformation, etc. So is there something you could recommend there? Is there something you'd like to comment on in this, you know, this push towards using more languages in more contexts?
Just before people respond, do use the Q&A function, and we will bring in questions into our discussion if you want to comment on anything that people have said. Thank you.
If I may, I think languages are important tools for communication, and I'm not going to discuss this with experts. What I'm trying to say is that it's not just the language, it's a bit more than the language, what can ensure an effective communication. And if I take this out of the pandemic scenario and put it back in my clinic room, we have in this country, in the UK, we have the service of translators that can help us to navigate a consultation with a patient that doesn't speak English or any other language that we can communicate with. But this is through a phone line, and this is through a kind of a very distant and very impersonal system. That yes, we can put words together that have a meaning, but the communication is not there, and is completely ineffective in many circumstances. And I think at a community level, it is even worse if you just use words, and the words translating what I try to say in my language, because that is not necessarily what I need to say, what that person needs to hear to understand what I'm saying. And I'll give you a very quick example. I was invited a few weeks ago to talk about vaccines and risks for people taking vaccines to the Union of Cleaners in the university sector, right? And I tried to make a presentation that was easy to understand and clear to the point. And I was told halfway through not even halfway through, 10 minutes into that there was in the chat or the Q&A function, because it was a Zoom meeting like this one, I was told that 80% of the people attending the meeting were coming from South America, people coming from South America, and they would prefer if I could say part of what I was saying in Spanish. And I did so. And then I started using examples of local things that I remember from my childhood that resonate with people from Colombia, from Ecuador, from Venezuela, and that changed completely the story. And that changed completely not only the environment and the atmosphere in the venue, but also the message was much more clear for them, and the questions were very honest, back and forth. So I think the problem is not just what we say, it's, you know, who is saying that and how is it said. So I think it's a massive challenge, honestly, and I think we rely on people like you to help us to do that, because I don't know how to do it.
Well, I think that, you know, you've put your finger exactly on what we're trying to do in modern languages, making people see it's not only about the language, it is about the language and the culture. And you cannot communicate the one without the other. That's exactly it. Absolutely right, Alejandro. Yeah. Yes, Charles.
Yeah, I just wanted to echo really Alejandro's point, and to a certain extent respond to your two questions, Godela. That sensitivity to a broadening of linguistic range is, I agree entirely, reflection of respect of wider issues around diversity. And I think we need to remember that the broad political context in which we've been struck by the current pandemic. It's one of rising populism, largely following the crash of 2008, a populism which is often associated with ideological monolingualism. Ideological monolingualism, which brings with it threats precisely to what Nelson's been talking about, threats to indigenous knowledge and an erosion of respect of local practice. Now, we haven't talked about Brazil, but Brazil's clearly a very striking example where there's a direct correlation between a populist government and a failure to manage the pandemic. There are other examples a bit further north in the Americas, where Trump's US, for instance. And I think part of humanities intervention here is precisely reflecting on the tensions between nationalism and internationalism. Because what we've seen over the past 12 months is the use of a pandemic as an excuse to consolidate borders. We're seeing that not least in the UK, but we're seeing it in other countries. We're seeing a rise in vaccine nationalism. And so the COVID-19 is being used precisely to erode what you mentioned, Godela, which is this emphasis on interconnectedness. And I think we need to see interconnectedness as positive and negative. Let's not forget at the same time that across Europe and indeed elsewhere, we've seen over the past 12 months a rapid rise in xenophobia and a suspicion, a completely ungrounded suspicion of, for want of a better term, the other. So I think multilingualism and that linguistic diversification you spoke about, Godela, is part of the work we often do in the humanities, grounded very much in the thinking of Caribbean intellectuals like Edouard Glissant, which is very much around relatedness as being an inevitable part of the human condition.
Yep, thank you very much, Charles. Absolutely. I think I'm looking at the time. I think I need to stop here, hand over to Charles so we can have some questions from the Q&A.
Yeah, I think we can sort of we can play off the two. There's an interesting question here from Barbara, who's saying that we cannot take clapping on the steps and similar signs as a literal message of support, indexing a considerate attitude towards others. For example, we're confronted with things like poor uptake of protective practices, masks, distances, which was evident in most aspects of daily lives, for example, in supermarkets or public places. And that points to a different kind of understanding. So in a way, we're confronted with how we read signs and the levels at which we read signs. So perhaps we might comment a little bit on that. I was thinking, I see you're nodding, Leon. Do you perhaps want to say a couple of words about that?
So on clapping on the steps specifically?
Yes, and how we interpret these and how we take these things literally.
Well, I personally did not participate in clapping on the steps. I find it is particularly problematic, of course, because so much of it was sort of state coordinated. And as you can probably tell from my video, that generally I don't really trust the government. So whatever the government tells me what to do, I tend not to do it. So yeah, I mean, of course, there are, we have to be very careful thinking about sort of that kind of performative or public performance of solidarity, I suppose, versus like a much more deeper level of organization, of grassroots movement that would really need to take place in this country and others. And I was particularly struck, sorry, this is sort of like going beyond the question of science, but I was struck by what many of us have been saying about the need for solidarity, the need for internationalism, the need for thinking beyond populism and nationalism, thinking of marginalized voices, and so on and so forth. And I think we do have a social institution that does this in many countries, and that's a trade union, of course. If we want an institution that commits to a certain kind of progressive politics, that takes care of marginalized voices in different classes and different races and sexuality, that has often at its best an international focus, that's about deep organization and solidarity, then I really think we need to pay very serious attention to trade union movements around the world. And I think in this country, the trade unions have been consistently right about the dangers of COVID-19. And I think we have some of the lowest participation in trade unions right now in this country, historically speaking, in terms of percentage of workers who are members of trade unions. So yeah, I mean, that's basically what I think.
Yes, and I think in terms of the way in which one interprets popular manifestations and the way in which they play a part in the shaping and the future of memory and its vehicles, I wonder if we could ask Astrid to comment on that.
Yeah, you know what came to my mind when I'm reading Barbara's intervention here, and I'm not sure I understand every bit of it, but you know, in the humanities, we are trained and we have a reputation of being very critical, and reading the science and reading them very critically. But I would not do this in moments like these to a very large extent that may even become cynical. I really think that clapping or other ways of showing gratitude, you saw that in Italy, you saw that in Spain, and I think it was there as an emotion. Next question is, does this collective emotion translate into more sustained action? Will they remember 1 week from here? Will they be happy to give some of their money to these care workers and so on? And I think that would be the challenge of translating these collective emotions that I think seem to be there. And I don't think they are false signs or that they are cynical in themselves, but how to make them more sustainable. I think that's what the question could be.
Indeed. I'm aware, Godela, of the time, and if we wanted to ask for a concluding statement, which you were going to do of our panelists, the convention of open for discussion meetings is that we do finish on time. So I'll perhaps pass the word back to you.
Thank you, Charles. Yes, just remains time for us to just ask all our panelists then for a final closing statement. And really, it's probably, you know, become clear in the discussion already what the main ideas are that we need to hang on to. But still, I would like to ask you all, what would be your top priority or recommendation for future transnational engagement? Let's just keep to the order that we had. Astrid to kick off again.
Okay. 2 things, immediate, and I would like to hear Alejandro's idea on that, but immediate, my feeling is we need that intellectual property waiver so that vaccines can be produced across the world. I think that's politically, for me, the next step. In a more general and abstract sense, let's find ways of using this experience as a resource in order to tackle new challenges that may come, climate change, whatever. So let's see if there are any collateral benefits, or with a word by Ulrich Beck, The Metamorphosis of the World, let's see if there's any emancipatory catastrophism in this.
Thank you very much. That's great. Leon?
So yeah, my thinking is like, first of all, we need to perhaps accept that certain things that are happening in terms of public health interventions and government power and so forth, they are happening because we are in a sort of quote unquote state of exception with the pandemic. And I think the most important thing to learn from this pandemic in this country, but also transnationally, is to make sure that some of the extraordinary interventions, like the temporary suspension of civil liberties, the use of sort of private communication data by the state, or the closure of borders and restriction on travel and so on and so forth, that those things don't become normalized and become concrete, that we have to always remember that what we're going through shouldn't be carrying on during quote unquote more normal times.
Thank you, Leon. That is an echo again of Ignacio's point about the Leviathan, isn't it? Yeah, very good. Thank you. Charles?
Thanks, Godela. I think one of the almost sort of truisms about the current pandemic is that COVID-19 has served as an accelerant of processes that were already in train. And some of those are positive, some of those are negative. They relate to public health. They relate to the use of digital media to meet as we are this evening. 12 months ago, I don't think we would imagine this. They relate to the rolling out of a universal wage, which, you know, some people call furlough. So sort of in sort of those sort of developments there, what strikes me is that in terms of transnational approaches to the pandemic, in a context in the UK, and this is broader as well, of state hostility towards the arts and humanities, I think what we're seeing is a real opportunity, notwithstanding that, to demonstrate the centrality of the arts, humanities, and indeed social sciences to addressing urgent issues of social concern. Now, in the early months of the pandemic, for understandable reasons, there was very much a focus on direct medical scientific intervention. But what we've seen more recently, and this panel is in many ways a reflection of that, is that the arts and humanities in particular, the social sciences as well, do not simply play an ornamental or a functional role. Think about what we've been talking about tonight: history, anthropology, mobility studies, translation studies, politics, area studies, literature as well, that they're all part of this major cross-disciplinary effort, which, as Astrid said, spills over into other areas as well. So I think my hope is that that message will be learnt, and one that we will internalize as well, because it's equally important for questions of linguistic sensitivity and some of the broader issues that I think you'll be exploring next week.
Thank you very much, Charles. I think that's absolutely central. And you know, if you think of cultural products as, you know, as a way of addressing experiences and memories, that's exactly what we need to think about. Alejandro.
Yeah, I think addressing the particular question on intellectual property and medical interventions, and you can talk about vaccines, but you can talk about something else. So what is going on in India right now, it certainly has to be considered in the context of manufacturing vaccines. So the powerhouse of manufacturing vaccines in the planet is in India. Most of the vaccines we use for many things are manufactured and produced and exported from India. So I don't think the problem is just who make what and where. I think the problem is access to, and that's another thing, completely different. And it's not just vaccines. So most people dying in India now, at least in some parts in Delhi, are not dying because they don't have access to a vaccine. They don't have access to oxygen support, which is another thing, completely different. So it's telling you that something is missing in terms of the structural concept of how care is provided in the health system at the national level, but also at the local level. And this is something that goes far beyond what the scientific knowledge can tell you on a molecular approach to treating the disease. It's far beyond that. We do have, at the moment, we have 4 small molecules have been proved to preserve and to protect people from dying in the very severe status of the disease. So you can reduce mortality if you have access to, and then the list goes on. The problem is, do you have access to that? How do you provide that to people? And provide that to people in a fair way and an effective way. So that's the challenge. And I think the other element which is important is, and I remember my teachers and my professors in public health is that story about that prevent is always better than try to cure anything. And this is the point of personal responsibility. We are learning important messages in here. So obesity is bad for many reasons, but also because if you are obese, you are more likely to die from COVID, and you're more likely to die from COVID if you are diabetic, and diabetes is associated with your own diet in some sites. So it is all these elements of public health messages that you need to put together and make sure that you communicate that in a way that people can understand and can make their own decisions, because at the end of the day, it doesn't matter what I say, is people are making their own mind on what they're going to do.
Yeah, again, it's that interaction and connection between the scientific and the social, isn't it? That's at the heart of it. Nelson?
Okay, ladies and gentlemen, thank you very much. And what we can see in the wonderful reflections which we have had is that we have got an urgent topical concern. And for us to confront this, I will suggest a multiple C approach, which I have just come up with, which refers to the issue of collectivity and connectivity, because that is quite critical. And this is what we have done already. We need to be concerned about care and cultural sensitivity. And then also the issue of collaboration, because without collaboration, we will go our separate ways and will not be able to deal with this global challenge. We need co-learning, because we need to learn from who exactly has done what and to what extent has this been successful. And then the issue of co-researching, because if we do not co-research, they are, for example, now we're talking about the South African variant, and how exactly do we tackle such as the global south. And then also we can talk about the co-production of solutions, and this can be both material and immaterial co-production of these solutions. And then finally is the issue of communication, and this is what we have been emphasizing, and even going maybe to next week when you talk of linguistic inclusivity and also diversity. Communication becomes quite central, and that's what Alejandro was talking about as well. Those are the multiple C approaches which I think that they can actually help us as we think forward. Thank you.
Wow, that was a very wide-ranging, very, very good summary. Stephen, last word to you.
Thank you. I was struck this evening by the repeated mention of borders. I mean, here we are obviously working across national borders, linguistic borders. There was mention of structural borders and some of the elements that can impede the delivery and the rollout of effective healthcare. But I suppose I wanted to end by thinking about some of the methodological or structural borders that we as a community will have to start thinking about as we take these conversations forward. As Charles said, I'm struck with the fact that we're sitting here this evening speaking through screens to each other, which you know, even a few months ago wouldn't have seemed ideal. I can tell you, having received my vaccine in the last 24 hours, if I'd had to jump on a plane this morning and go to London, I probably wouldn't have been in any state to join you. But you know, there's great benefits for being here this evening and being able to do it in this way. But I do think that there's an important discussion for us to have, an important reflection for us to engage in about how we take these conversations forward. How do we ensure that this, you know, this sense of momentum that we have at the minute in coming together from our various disciplinary perspectives, how can we harness all of that? How can we ensure that that energy isn't lost? And how can we make a proper difference to some of these global challenges that we are seeking to challenge? So there's some organizational, some methodological issues for us to work through there, but also I think for us, and I think particularly in a UK connection here, where we're repeatedly told we're living in a new global Britain, for many of us it doesn't feel overly global with some of the cuts that have been announced to some of the major international schemes in the last few months. So I think we're going to have to think very carefully about how we build and nurture some of the partnerships that we already have and that we want to see developing in the months and years to come.
Thank you very much. And I think this is now the moment to give Charles the very final word as director of the IMLR. I hope he'll say that the IMLR is the place to do this.
Indeed. Thank you, Godela. The IMLR is indeed the place to do this. It provides the opportunity for us to discuss things in a very focused and extremely wide-ranging, both geographically and methodologically way. I have very little to add to the powerful nature of the reflections and the discussion, except to say that the videos that our panelists prepared are on our site. We will, of course, be adding the recording of today's event to that site, and I think it's a powerful resource because it provides us with the opportunity to reflect on so many issues across borders, to be thinking about community, to be thinking about memory, to be thinking about action, and to be thinking about the way in which we can create fora and disciplinary and interdisciplinary communities with a real sense of purpose and activism. And I'd just like to thank our audience, to the organization structures behind that made this event possible, and everyone that was involved in that. And to thank once more Stephen for his work in bringing things together, and to our panelists. So thank you very much on the part of Godela and me and the IMLR. And I hope to see you next week for our follow-up event organised by Joe Ford and Naomi Wells. Thank you very much.